Seefeld, Executive Vice President here at MedEvolve, an effective intelligence company. Today, we're going to talk about vendor versus consultant. And I'm smiling for a reason. I started my career in consulting where I was asked to go into healthcare organizations. And I was frankly asked to look at people and process and existing technology and then make recommendations on how to change all that to drive financial performance. Most of the time, we were brought in at the board level. Most of the time, the organization bought into the concept that whatever the consultants say to do, do. What's interesting is about a year after these engagements, we would go back to a lot of these clients, and the problems that we tried to solve a year ago were still there. They'd come back. Or the recommendations that we had set forth were never followed through on. So that's one part of the problem. Then I switched careers and I become a vendor. So the question is, which is better? Is it better to be the consultant that goes in and tells you the areas in which you need to improve on to drive benefit? Or is it to be a vendor who's trying to solve a niche problem with the technology and or a service? There's pros and cons to both. I think the consultant side gets very frustrating because we spend a lot of time traveling, flying in Monday, flying out Thursday, working with organizations trying to impact change. So when changes don't occur and the results aren't there, it's a little bit of a hit to the ego. At the flip side, being a vendor can be very frustrating too, because, for example, when we go in and sell, it's a very consultative sale. We do not make the promise that by just installing this technology that you're going to get results. You have to be willing to look at, guess what, people and process and how that aligns with the technology I'm selling you to get the result. What's interesting is many organizations, they don't want to accept that fact. They want to assume that they can go out and just buy a tech for whatever it is. It could be a propensity to pay technology. It could be a waiting room app. Where it becomes frustrating as a technology and or service vendor is the fact that we work really hard to develop solutions that will actually drive the benefit that the consultants are promising. So best case scenario is consultants come in with the technology and or augmented service and put it all together. And that's actually where I've seen a lot of success, frankly, in my career, is when the consultants are already there, they know it needs to be done. They bring in the right technology partner, the right services partner to get the results that the consulting firm promised the board of directors and the executive teams. So that's the best environment. I was sitting at a trade show last week and I'm looking at all these different vendors. Everyone's got their stress balls. Everyone's got their little putting greens. Everyone's hoping that that one physician doesn't just walk straight to the bathroom and actually stops and says hello. But each one of these vendors is out there with a real solution, a real technology or service solution that they feel is going to be very valuable to these organizations. And so what's always interesting to me is that when I talk to executives, I talk to physicians, they talk about they need to reduce overhead. They need to improve profit margin. They need to improve net revenue. They need to reduce their dependence on labor. They need more automation, right? All those business objectives. I could just go and list them all out and I could put them up in front of any prospect I have and they would just say, yeah, that's right. You're right. That's my objectives. But then what happens? What happens is rarely does someone then make the leap to go find those solutions to actually go get those results. Okay. So again, a year later, I have same conversations as a vendor with the same prospects who said a year ago, this is what they wanted. They weren't willing to make a change, and they're actually worse than they were a year ago, or they were just slightly better. And that's no way to live. In this new world of work from anywhere, in this new world of staff want more money, in this new world that we're living in, you cannot afford to lose a penny or two or even more on your P&L. You just can't. You couldn't before, but you certainly can't now. And so I hope that this industry, and this is a long shot because I'm not sure it will, 22 years into this journey, But I do hope that this industry finally wises up and realizes that as much as the service side of healthcare is embracing technology and advancements and robotics and better outcomes for patients, that the revenue cycle software and services side of the business starts to wise up and realize that they also have to innovate. They have to take risks. They have to install technology. They have to hold people accountable. It's been a dichotomy that has amazed me for all the years that I've been here, is that we work so hard on delivering care, but where's the work to make sure that you're getting paid what you're supposed to be paid? And when that doesn't happen, how quickly do you know why? So if you're out there, you're trying to drive profit margin, even if you're not even if you're a not-for-profit entity, you still could take cash flow and invest in R&D and all these new things that would help the communities. You have to listen to the consultants. You have to look at the vendors. You have to bring in vendors who have a consultative implementation approach, making sure that your people and your process is aligned with the technology to get the result that we all want.